Hello, I'm Sabina Allam, editor of BMC Medicine. We're here today to talk to Dr. Alfred William Frankland, who's also referred to as the grandfather of allergy. Over the last 60 years, Dr. Frankland has made extraordinary contributions to medicine. In fact, he pioneered the very first double-blind randomized control trial on allergen immunotherapy. Also, his research into allergic responses to pollen led to the inclusion of pollen counts into the UK weather forecasts in 1963. At 101, he remains very active. He continues to practice as a physician, and he continues to publish papers. In fact, he'll have 5 out this year. He also attends international conferences, and we hear from his colleagues that while there, he continues to ask them very pertinent questions. In this interview, we're going to talk to Dr. Frankland about the highlights of his career, about his experiences of working alongside Sir Alexander Fleming, and for his opinion on why some misconceptions about allergies and allergen immunotherapy still exist today. Dr. Frankland, thank you very, very much for joining us today. It's a great honor to be able to interview you. Can you start by describing your early life and what inspired you to enter medicine?
Why did I take up medicine? I think because I rather despised, when I was young, a GP. This was in the Lake District in Cumbrian, and he came to see us. In fact, I had bovine tuberculosis and was kept in bed for 4 months, and they said it was all due to my tonsils, which was then removed. Anyhow, I didn't like this old man, and I thought, when I grow up, I'd like to be a doctor. And so that's really how I started, I suppose. When I was a medical student, we were given, as medical students, we twice went to the eye department and twice to the ear, nose and throat department to learn all about eyes and for finals. I went to the eye department and saw a blonde girl with beautiful eyes, and I thought, I must get to know this girl. I went for a second time and I was sure about it. So what happened? This is quite interesting, that because they only had 2 beds, eye beds, and in the ear, nose and throat, and the eye department, they didn't have what in those days were called a house physician or a house surgeon. But so they employed a senior medical student. So to get to know this girl in the eye outpatient, she was working there as an orthoptist, in fact. I applied for this job, and it was a risky thing to do because you were kept very, very busy. You put on a long white coat, everyone called you doctor, and you were acting as a doctor for 6 months, you see, although you were still a medical student. And this was quite interesting. Anyhow, it had its bonus because I got to know the girl, and we were finally married in 1941. So, I'm a slow worker.
You joined St. Mary's Hospital in 1934 and qualified in 1938. By 1946, you found yourself becoming interested in allergy. How did that come about?
This was, I became interested in allergy completely by chance. After 6.5 years in the war, 3.5 years as a prisoner of war, back to my own teaching hospital, St. Mary's, and we were given what was called registrar, ex-service registrar jobs. And I'd chosen to do dermatology and special clinic, BD. I hadn't been doing this for more than a month when a notice went up saying that they wanted a doctor in the allergy department for 2 mornings a week and 1 afternoon, and I was free on those. So here was a chance of getting a little more expertise in a subject which at that time I knew nothing about. So I started in the allergy department, and after 6 weeks liked it so much I went to Dr. Freeman, my chief, and said, could I be full-time? And since that time I've been full-time allergist at all times.
So while you were at St. Mary's, you worked with Dr. John Freeman, who was working on allergy, and also with Sir Alexander Fleming, who was working on penicillin. It's been said that as you were on good terms with both of them, you acted as a bridge between their research. Can you describe that time for us?
Well, Dr. Freeman, we always called him JF, and Fleming, we called him Flem, didn't get on at all well together. My chief was Freeman, but after a short time, I was looking after the what was called the experimental ward, and therefore I had to see Professor Fleming every morning at 10 o'clock, supposedly to talk about the patients, but we never talked about them. He wasn't interested in clinical medicine, but he was a fascinating man in so many ways and extremely clever. And I loved and really enjoyed these 10 o'clock meetings. It happened that he didn't get on at all well with my real chief, Freeman, but that didn't matter. I just continued, as it were, having two chiefs. But after, I don't know, 3 or 4 years, I never saw anything of Freeman, but I inherited all his expertise, including, of course, the largest pollen farm in the world. We produced pollen which, not only for experimental purposes, and we used large amounts experimentally, but we also sold pollen to America and Spain and so on. A little tree pollen, that was silver birch pollen, but for the most part, Timothy grass pollen. So that was just a little extra. But I loved going down and seeing all the expertise of how to collect pollen. And this pollen farm, in fact, was run when I first went there by Dorothy Noon, who was the sister of Leonard Noon, who in 1911 at St Mary's Hospital started and gave in the world the first successful treatment of seasonal hay fever. So an allergy clinic has been running at St Mary's from about 1906 to the present day, and that's a very long time.
So since the regular use of penicillin as an antibiotic, you started to see some patients developing allergic reactions to this. At the time, the concept of allergy was still very new, and particularly the concept of having an allergic reaction to drugs was very new. How did you deal with this at the time?
Well, those days, I mean, we had to recognize that this new wonder drug, penicillin, not only had great benefits to diseases that were killing people, but now was changing the whole of medicine. But it also, like all drugs to this present day, could cause side effects. And the side effects, as far as the allergy department was concerned, was allergic reactions. In those days, and almost still today, it can be very difficult to work out exactly what bit of the penicillin molecule people are allergic to. And we just said this was an allergic reaction to penicillin, and you mustn't have any more penicillin because it could, instead of being beneficial, could be fatal. And the sequel of all that, of course, was the book that Fleming had written, and this was a multiple authorship book just after the war, and every doctor in the country so on, had to have this sort of Bible of how to treat all sorts of infectious diseases and so on. And he sold, in fact, 175,000 copies of this book, which is a little unusual for a medical book, but it was the Bible of treatment of infection. And then after 2 or 3 years, Butterworth, the publishers of the book, decided that it must have a second edition for 2 reasons. They wanted 2 more new chapters, 2 added chapters, and one was on the new mycin that had just been discovered by Waxman, streptomycin, and the other chapter was a chapter on allergic reactions, and Fleming was always against this idea. In fact, he always insisted that the reactions from penicillin, a lot of it was given by injections, of course, in those days, was due to impurities in the preparation, toxic. But after 6 months, the publishers finally said, you must get this second edition out. And so one morning, and I had to go and see Fleming every morning at 10 o'clock, he said to me, Frankland, you're going to write this chapter on penicillin reactions. I'll give you a week to do it, 3,000 words, not more than 30 references. So I wrote it that week, and on a Monday morning, I still remember giving it to him, and he said, I will read it tonight, and I'll tell you tomorrow morning what I think about it. So on Tuesday morning, I was really quite dreading what he might say, but no, he was always his very nice self and said, I'm not saying I agree with everything you have written, but I'm not going to change it except your very last sentence on the last page. And he crossed this last sentence out and wrote in his beautiful handwriting, I had written, with the increasing use of penicillin, it is to be expected that allergic reactions will become more common. Mm-hmm. That was all taken out, and he wrote in his lovely writing, with increasing use of penicillin, reactions, no word allergic, will mm-hmm. become, due to impurities, prevalence will become less common. And that's what's in the book. And to some extent, he was right, but also I was right.
So when you co-founded the British Allergy Society in the late 1940s, you and your colleagues, which also included Professor Jack Pepys, were told to define allergy. How hard was it to reach a consensus?
How hard
was it to reach a consensus?
We'd advertised that we wanted to form this British Allergy Society, and so it was advertised that we were going to have this meeting at St Mary's, and there were going to be two speakers. One was John Freeman, who was going to talk about hayfever and allergic reactions to grass pollen, and the other was Sir Henry Dale, who was going to talk about allergy in general. But Dale was really in charge. They both gave interesting lectures, but at the end of it, Dale said, if you're going to form an allergy society, you should agree on some definition of allergies. And Dale said, there and then, Frankland will be the secretary of this new society, and his suggestion was that everyone should write their definition of allergy and send it to me by post. And I don't know, about 12 arrived in the next week or so. I tore them all up. They were all, most of them were not what I would call a good definition, and one which certainly wasn't a definition, but I still remember it came from Scotland, and it said, allergy is a grossly overused word by the lay public, and that was yes, more than 60 years ago. It's still true today, of course.
Thanks to your work on tracking seasonal variations of pollen counts, levels of pollen became part of mainstream media broadcasting in 1963. This was obviously a very huge impact to public health and public health awareness regarding pollen and the effect that the effect it can have on people. How did that make you feel?
It was very interesting that Freeman was very keen on pollen, and I wanted to enlarge on his interest, and actually a further almost major interest of mine in what's called aerobiology, but mold spores, fungal spores. That's something else, another subject as it were. But we had these special clinic where we used to see patients who only had seasonal hay fever with or without an associated asthma. And we saw these vast number of people. In fact, I don't know if you know this, but this clinic was so popular at one time, I was asked to explain by the House Governor why there were so many people. He said, you are taking over St Mary's Hospital with your clinic. There's so many. Will you tell me how many you've treated this or seen this spring? Because we used to see them pre-seasonally for desensitizing injections. And I said, I'll give you a figure in a day or two. So 2 days later, I saw his secretary and I gave him a figure. And I said, we have seen just over 6,000. Now this is a large amount. People just don't believe we could see so many people, but we employed 2 teams, and I paid medical students to do to take the history or to do the skin prick test and so on. So we had 2 complete teams running And my proud boast was that no patient would ever have to, from the time that they arrived to the time that they left, that would be 1 hour. And the reason for this was that, because people were coming a long way, but theoretically the first patient was, the first appointment was at 2 o'clock, but the patients were fully going at 1:30 because so many people arrived early. Wow. So people weren't kept waiting at all. But I was ticked off for having this popular clinic by the House Governor and told I had to half the number next year, so I had to cut it down to just over 3,000 and so on.
Since your seminal paper in 1954 on prophylaxis of summer hay fever and asthma, there have been numerous studies published on allergen immunotherapy for the treatment of allergic respiratory diseases. However, there's still some misconceptions about this type of therapy and also about allergy in particular. You've outlined some of this alongside Professor Moses Calderon and Professor Pascal Demely in a paper we're publishing in BMC Medicine shortly. So despite the clinical evidence available, why do you think these misconceptions about allergen immunotherapy still exist today?
There's so much to learn what is happening when you're using immunotherapy. I mean, nowadays, this paper, of course, is about oral treatment and not injection treatment as I used in the mid-1950s and so on. And I think more and more we're going to go on to the idea that nature intended, if you're going to bring about immune tolerance, people who get sensitive, and can you stop this sensitivity, more and more it's going to be given, I think, orally. And that's what nature did through breast milk when a baby and so on and so forth. But so many people distrust, I think, whatever you're doing, and perhaps the distrust may be that how does immunotherapy work, whether given by injection or given by mouth orally? And the answer is, we really don't know. It's a very complicated business. But unfortunately, in this country, compared with other countries, America and Europe and so on, the number of allergists who are using this treatment, although some of the best research work in the world is done in this country, but the number of allergists who have to treat patients with allergic diseases is amazingly small. And we've nothing like enough consultants, clinics to deal with this problem. And I think it's rather like alternative medicine would like to take over, as it were, this bit of medicine which people don't understand fully. And it's a fascinating subject to see now what's happening intracellularly and the whole of immunochemistry. And we're learning a terrific amount of and getting new ideas all the time. But I mean, the same applies to cancer or any other disease. The double-blind controlled trial that I did at the same time in 1954 on infective asthma, because in those days the bacteriologists were absolutely in charge of calling, if asthma wasn't, or hay fever and or asthma wasn't allergic, they thought it was infective. And therefore my chief took a swab, and a very complicated business. Any bacteria that were growing, he said, oh, people are reacting to this. They haven't got an immunity. And he made what's called an autogenous bacterial vaccine. If there weren't any abnormal organisms, he would give them what's called a stock vaccine, the sort of things that number of bacteria that you find in your nose or your throat. And that was the treatment then, and there was a lot of people receiving this treatment. So I did a double-blind controlled trial because I didn't believe it gave any scientific help. And we found that the placebo injections, compared with these very expensive and difficult to produce autogenous bacterial vaccines, placebo gave exactly the same amount of help. The interesting thing is the amount of help with all the criteria that we're using they helped 50% of people, but well, 49% were helped by the saline, 51% were helped by the autogenous bacterial vaccines, and you don't have required any knowledge of statistics to know that these two figures in quite a large series of people are the same. That paper caused so much interest that, in fact, I was invited, still as a registrar, to go and give a talk at the International College of Physicians. I think one of the first ones that was found after the war. They started having these. This was in Madrid, and I gave a talk there. And 2 months later, I gave a similar talk in Los Angeles. So it was interesting that that trial caused internationally much more trouble, much more interest than the trial, the double-blind controlled trial on pollen. And one of the reasons was, I mean, that statistics and double-blind controlled trials were a thing that people weren't doing. And then the publication of the bacterial ones was showing that a treatment didn't work. And in those days, if you did anything or used a drug that didn't work, you didn't talk about it. Here was I publishing a statistical double-blind trial on something that didn't work. And so that caused interest too.
You're now 101, yet over the years you've faced a few life-threatening situations, such as being a prisoner of war for 3.5 years in Singapore during World War II, and also going into anaphylactic shock during a set of self-experiments on your allergic reaction to a South American insect. How are you still here?
Yes, people ask me how is it that I have reached 101, and I say the answer to that is I have been so near death so many times, but I've always just missed. That's why I'm still alive.
There's no doubt you've led a remarkable life, Dr. Frankland, and thanks to your dedication to medicine, people like us benefit from being able to, first of all, plan for the summer. I myself track pollen counts avidly throughout spring and summer, so I can plan what I need to do for that. And it's thanks to you, really. What would be your advice to physicians, particularly allergists of today?
Advice to allergists? Well, in this country we are very good at doing research in allergic problems, and it's a very complicated business looking at what the cells are doing, and the whole of immunochemistry is in all branches of medicine is advancing so much. So I always say that, and I've been interested in Asthma UK, a charity and things who give lots of money. So research, and a lot of very clever doctors doing research, and there's a few, and this is the problem, there are a few professorial places in the UK that are run an allergy clinic and doing allergy research, but nothing like enough compared with America or even most countries in Europe. We are not spending enough on research, and we haven't anything like enough clinics going and enough doctors, general practitioners as well as others, who know almost the elements of this very complicated business of allergy.
Excellent. Well, thank you very much, Dr. Frankland. It's been a real pleasure.